Hello, and welcome to the Community of Care's presentation on suicide. Today we're going to talk about certainly resources as well as risk factors and give you some information which we hope will prove helpful. We're here today because as of late, certainly there's been a lot of media discussion around the topic of suicide, as well as an uptick on some occurrences here in the greater Farmington Valley. So again, together with my co-host, Tom Steen, we hope that this program will be helpful and informative. My name is Sue Homrok-Lemke, and I'm the Assistant Superintendent of Pupil Services in Simsbury.
Hi everyone, my name is Tom Steen. I am a resident of Simsbury and I'm the Director of the Capital Area Substance Abuse Council.
So today we are going to talk about risk factors. We're also going to share with you some resources, both in school resources if you have a son or daughter of that school age, and additional community resources that may be of benefit and help to you. Finally, we will touch upon the recent media uptick regarding suicide and provide some hopeful tips for you to use with your loved ones and your family members. So Tom's going to start us off with talking about some of those risk factors.
Yeah, thanks everybody, and thank you, Sue. Some of the things that we notice when folks are struggling with suicidal thought or some sort of emotional direction, the key thing is to know the warning signs and the risk factors around somebody that might be in trouble or appear to be in trouble. The first thing we talk about really is the kind of the situational type of warning signs, and situation might be there's a breakup in the family, or there's a loss of a job, or some sort of struggle that the person's having. So the situational clues are important. And then there are behavioral clues. People who will have a sudden interest in religion or religion, giving away personal belongings, especially with young people, is a big one. And the thing that always is a key warning sign to somebody that might be struggling is the feelings of hopelessness and helplessness. And this is where we find people who kind of bury themselves in a bedroom or stop going out in public. And when you put all of these things together is when somebody should be concerned and begin to reach out for resources. One of the things I wanted to share with the audience today is that, one of the myths and facts of suicide is when you talk to somebody about suicide, it makes them more suicidal. And in fact, it's the opposite. And so when your gut, and it doesn't matter whether it's a young person or it's an adult or somebody in your life circle who you're feeling that there's something really wrong and there's some risk factors and some things, a person's just not right, you shouldn't be afraid to ask. And we really come straight away and ask the question, are you having suicidal thought? Are you that depressed that suicide's now in your thinking? Because those are the triggers that that will really relieve the individual, because finally somebody is really listening to them, and it's like taking a big weight off their shoulders. And as a loved one, that's the time to go get help. And we're going to share today some places where folks, especially over the summer months when school's out of session, where there's local resources that folks can reach out to help.
And Tom has been very invaluable to us in the schools. He actually came out and did a full district professional development, and one of the methodologies, this QPR, which you may touch upon, the first Q is around question and asking those questions. Some may think, okay, we shouldn't talk about suicide. Again, that might increase the probability of someone trying to take their own life. But again, we find that to be just the opposite. And that questioning gives people a sense of relief that someone's noticing and someone's caring about them. And I think it's really important, and one of the mission points of the community of care is really to take the stigma out of these issues, to take the stigma out of talking about suicide or other mental illness, so we can best support our students and certainly our community members and our loved ones. So I don't know if there's anything else that you want to add to that before we go into resources.
Just that the QPR stands for Question, Persuade, and Refer, and it's an evidence-based suicide prevention training program. It's available. I'm certainly more than happy to run a gatekeeper training again. I'm free, so that's good. But it's a really good tool as far as learning how to ask the question when you think somebody's at risk. But also, what do you do once they've shared that information? How do you persuade them to go for help? And then there's some like little secret pearls into how you get somebody to a referral. And there are. The state of Connecticut, not like a lot of other states, we have resources. Just need to know where they are and how to get to them. So QPR, Question, Persuade, and Refer, is a great suicide prevention evidence-based program.
Great. So let's talk a little bit about what those resources might entail. And I'll certainly start us off with the school portion, and then Tom can talk about those little pearls that he just alluded to a second ago. So as far as your school resources, again, I know sometimes there might be a hesitancy on the behalf of families that, we don't want people making assumptions about our children. And please know that we would so much rather talk with you about those potential issues and be able to question initially and then finally refer to resources, that we welcome those conversations. Certainly your school counselors, some may refer to them as guidance counselors, are all trained professionals that are a great source of resource for you and for your children. Also, our school psychologists, certainly they've had the QPR training from Tom, and they've had some additional more in-depth training to be able to identify certain risk factors, to develop the capacity to carry out risk assessments, and then to refer students and families to particular agencies. So your school psychologists are also a really great resource. And there's at least one school psychologist in each one of our 7 buildings. Additional resources are our school social workers. Again, they've been trained to give risk assessments, but they're also very adept in determining which paths to recommend, and again, those resources. But it really comes down to rapport. And we always say that those relationships with students and families are of paramount importance to us in the Simsbury Public Schools. Please know that if you come to any one of those individuals, we will be listening with an open, intentional, purposeful, and caring ear, so we can make sure that your families get the supports that you need. Also, any school administrator also has this background, this training, and they are adept in being able to refer out if additional supports are needed. So those are just some of the people, certainly, that you can start to access, and then we can put you in line with different resources. Certainly, if you are not necessarily comfortable with any of those folks, we hope that you would be in the Simsbury Public Schools, but then reach out to a teacher, reach out to a coach, because even though they might not have all of the information, they can connect you with somebody that does.
Great. It's so nice to know that we have as great a school system as we do here in Simsbury that has these services, and certainly parents should reach out and utilize them because they're really good.
Thanks, Tom.
And I work with people across the state, and yeah, I'm a little biased because I'm Simsbury, but I wouldn't say that if it wasn't true. So anyway, I'm going to talk more about lifespan, because suicide knows no age, it knows no certain community or ethnical background. Suicide is a part of our society, and we're trying to really work very hard to minimize it. Wouldn't it be great to say that there's zero suicide in our communities? So let me share some resources out there for folks, and it goes lifespan information, so that when you think you need, or you just want to educate yourself, you can reach out. One of the things that we have in Connecticut that's unique from most other states in the country is we have a suicide advisory board. It's a prevention thing. It's a statewide initiative. It meets once a month, and actually we are meeting tomorrow morning. Okay. So, and part of that Connecticut Suicide Advisory Board is we created a statewide plan, a 2020 plan, and one of the things that came out of that plan is a website called preventsuicidect.org, and it is a great resource. It has everything you need to know or want to know, whether it's about suicide in an older person or in a younger person. Just having resources to be able to educate yourself is really important. So I really strongly recommend that folks use that. The other place that I personally volunteer for is the American Foundation for Suicide Prevention. And here's a place not only for prevention of suicide, but when a suicide does occur, we know that there are people affected within that person's not only immediate family, but the circles beyond. And there are several different services that are really provided by volunteers, which is the really cool thing, to help those who have lost somebody to suicide. Yesterday, I'm a volunteer for a program which is a survivors outreach program, where I literally went to somebody's house with another volunteer to talk to a family that had just recently lost a person to suicide. And it just helping people to be able to talk about it and to find a place of healing and being able to move on with one's life is, after such a tragic loss like this, is really important. So afsp.org is another place that you can go. And the last in our state is 211. Because you can call 211 when the answering unit comes on, press 2, and the system will take you right to a social worker 24/7. And especially now we're facing summer months now, and we're going to talk a little bit about some of the things going on in social media right now. This is a really great place. Whether you think somebody's in trouble or not, you can talk to a social worker and say, here's what's going on. What do you think? Should I be so nervous? It's a great service in Connecticut, so do utilize that. If you think somebody's at risk of hurting themselves or others, you call 911. That's right. Our police department is they have a crisis intervention team. They're very well trained to help in a situation where somebody's having a mental health emergency. So please utilize that. The last thing I want to share is a nationwide, it's the suicide hotline. And I didn't bring my cheat sheet for that.
That's okay.
But you can easily go it. It's the National Suicide Hotline. And here in Connecticut, because we have the 211 system, that 8100 number brings you right to 211. And that's a national number that's been promoted. And again, it doesn't mean that you might be challenged or you think somebody else is challenged. You can use that hotline to get information and be able to build your knowledge base on this. Certainly is a public health issue for us.
And thank you for mentioning the 211. We use that as another tool that we have in the school system. We actually have a memorandum of understanding with the local 211 agency through Wheeler Clinic. And so that's been a really nice partnership that we've developed. And, some people have some misconceptions around that 211, but they have the opportunity not also to provide you some crisis intervention right in the here and now, but also some additional resources, information, referrals, and there's an education component to that resource as well, which is really unique for Connecticut, and I hope gets to be utilized more.
Great. So please do utilize those services, and There are the agency that deals with adult mental illness issues and addiction issues in our state is the acronym is DEMAS, Department of Mental Health and Addictive Services, and there are 8100 number there that adults can reach out to get help. And again, it's all website driven, so you can go to the state of Connecticut's portal and click on the DEMAS link, and all of that information will be there for you.
Fantastic. So let's switch over to media. We've been hearing a lot of, there's certainly the show 13 Reasons Why, I'll get to that in a minute, and some pretty scary apps that students could be accessing, other adults can be accessing on their phone. We share this with you not necessarily to make a criticism of the actual media source. That's not our role, but our role is to present information to you so that you as a parent, as a partner of someone that you care about, can be informed. Certainly from the school vantage point, I had recently sent out an email regarding 13 Reasons Why. It is a fictional Netflix series of a young lady who does take her own life and leaves behind 13 cassette tapes that are addressed to 13 different people in their life. And in those cassette tapes, she actually discusses what role each one of those individuals had on her decision to take her own life. I think that Tom might talk a little bit more about that actual source. What I've shared with parents, with guardians, with the greater community is just be aware that certainly the series is out there and that your children, your loved ones, could be accessing it. The information is intense. There are major threads of fiction through this series. So we want you to make an informed choice in whether or not you decide that this is an appropriate media source for your children to be exposed to. Tom, I don't know if you want to comment more on it.
Yeah, there's some talking points that the American Foundation for Suicide Prevention has posted, and certainly we could give this to the station so that they can distribute or put it as part of the forecast. Okay. But it talks about key talking points, and the pros that have reviewed this and discussed this have some really, I think, important steps that anyone can take when considering watching this particular series, 13 Reasons. They're all saying that parents should preview it before they let their children see it. And once they've done that, then if the parent makes the decision that it's okay for the young person to watch it, then they should watch it with them and not to binge watch it, because they're very, very sensitive issues in each one of these 13 things that could trigger something in somebody, especially somebody at risk, that could put them in danger. Mm-hmm. So it's really important that parents take an active role in deciding to watch it. As an adult, and I'll tell you, for me, I got through 5 of the episodes and decided to stop for my personal reason, and so I mean, it's challenging, and so I would really caution folks. Remember talking about the subject about suicide and some of the other subjects. It's good to talk about it openly, mm-hmm. and these messages and things that this series portrays, just leaving them out there without. The kids in the city call it speak it out. To have a time where you can speak it out so that everybody understands what they saw and be able to pull it together. One thing that the experts are saying is, leaving messages like this are not normal, and it's not what happens, and so folks really should understand that, and that no one's to blame if somebody dies by suicide. It's something I always, when I do my trainings, suicide is a symptom of something else going on in the person's life, which is why it's so important that we're sensitive to how people are feeling, and when they're at risk, getting them to the experts they need for help. So I do suggest that they go to 13 Reasons Why. But I'd like to finish my comments by, there was a group of high school students out of Oakland, California that started this 13 Reasons Why Not.
Yes.
And if I may, share the 13 reasons, because the first one is you're not alone. And when you're feeling, you have those dark, deep feelings upon you, there are people around you that can help. We are here for you. And I think that's a clear message that, when people are having suicidal thought, they don't think there's no one around them that can help. And so know that we're all here for each other. We want to say it's okay to ask for help. I mean, that's an important thing. And it goes for adults too. I mean, it's just not kids. There are a lot of people out there that want to help. Your feelings are valid. And many times when folks are feeling that stress as they don't think their feelings are real, that they're fake or they mean anything. No, they're real, and you need to share them. Words and thoughts matter. I think pretty self-explanatory. We can get through this together. That's a big one when we do suicide prevention training, QPR. That's a message. And when somebody has come to the point where they are sharing where they are personally with their thoughts about suicide, that's the message of hope that we want to give, that we're with you and we'll help you get through it. Number 7 is we believe in you. Number 8 is you are wanted, you are needed, and you are loved. And I think that's powerful. There are resources available to you, which we just discussed. You are not a burden. And people with suicidal thoughts or feelings, and many times in our older populations, feel they're a burden onto others. And you know what? That's not the case. Love is love, and we want everybody to be with us as long as they can. Lean on to others or lift you, because they'll lift you up. So that's a key. You matter in those in your life. And apathy is one of those things that people that are in that dark, deep place feel. And the last one, which I think is the powerful one, is don't give up. So 13 reasons why there is hope. So if out there, folks, go on the internet and pull that up. There's several stories on it, and it's very warming. But I like 13 reasons why not.
And again, just as a reminder that was written by teenagers, and they're such a powerful source of information, and it just reemphasizes the point how important it is if you are the parent of a teen or a child to keep that dialogue going, to ask those questions, to be nosy. It's okay to be nosy and butt into their business because it shows that you care. So more wisdom from teenagers. Just another reason why I love them so.
3 thumbs up.
There's also been some recent social media apps that have come out. There's one called the Blue Whale. The Blue Whale is an app that basically engages whoever downloads it on their phone to engage in risky behavior. And the behaviors continue to be upped notches with every single behavior, and it culminates in the final behavior of taking one's life. So again, I say this to share with you just so that you are aware that some of these social media apps, different things are out there. So again, ask those questions. Parents, be nosy. I'm sure that in most cases, your children are not paying for their phones if they have them. So that means you have the right to look at them, search them. There's apps that hide apps. So again, just be aware, ask those questions, and continuously send the message to your children that you care about them, that you love them, and that you can work through issues together.
To piggyback on Sue's comments is these apps are about self-harm.
That's right.
And I think as parents and as community leaders, we need to take an active step in letting people know that self-harm is not acceptable. The thing about this Blue Whale app or game or whatever you want to call it actually is able to get into the owner's phone and be able to access their contacts. Mm-hmm. And that's how the group is built, and then they push on each other for this self-harm stuff. So it's thank God that our country and school system across the country have been communicating that this is out there, so that parents are informed. It started out in Europe, and there's some misinformation coming out of Europe about the app. Just know that it's out there, and not just only this Blue Whale, but other programs out there that promote self-harm. It's really there's just no room for it.
Right. So be aware, ask those questions. And if you're not sure of what to do, and maybe you're not even sure if there's an issue, you just have a gut feeling that something's up, reach out to one of those resources that either Tom or I shared, because we'd rather have a conversation about it and problem solve together. So I know we're reaching kind of the end of our time here together. We really, on behalf of the community of CARE, we hope that this information was helpful to you. Just to share a little bit of community of CARE, we are a group that incorporates community members, political members, clergy, nurses, pediatricians, school membership, students, and we come together to really talk about how we can promote the sharing of information and resources around issues of addiction, around issues of mental health. So we try to do some quarterly programming. If you are interested in learning more about Community of CARE, please check out the Town of Simsbury website. We do have a banner on the side that leads you to some additional information and links to previous programs that we've done. Certainly, we're always looking for program ideas. We do this for you to benefit the Simsbury community. So if you have ideas or topics that you would like to see happen, please make contact through that website. You certainly can get in touch with Tom or with me, and we will make sure that those ideas get talked about, discussed, and acted upon. So on behalf of Community of CARE, Tom and I thank you for tuning in, for listening, and we hope again that this information has been helpful to you and your loved ones.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.